Bismillahirrahmanirrahim. Assalamualaikum warahmatullahi wabarakatuh, and good evening to everyone. I am Dr. Abdul Rashid bin Abdul Aziz from Faculty of Leadership and Management, University Science Islam Malaysia. Today, I would like to present my topic entitled The Effect of Progressive Muscle Relaxation Using Biofeedback Therapy on Engineering and Technical Student. As an introduction, we know that students in university or college facing lots of problems, psychological or psychophysiological problems. Among the problems are increase the level of anxiety, depression, worse sleep quality, fatigue, muscle tension, unhealthy eating habit, low physical activity, low self-esteem, suicidal tendency, decreased academic performance. There are many contributing factors to the problem among students. So, as we can see that the stress response is a close feedback path between the muscle and the mind, according to Snyder and Inquist. So basically the stress is happen in muscle and also in the mind. So it affects our psychological aspect as well as the physiological aspect. There are no specific techniques have been developed to help the student to have better coping strategy to handle the stress in their inner self. As we know, there is a lot of coping strategy from psychological perspective, but when using into the psychophysiological factor or psychophysiological strategy, there is no research that had been conducted among the university student. So that the technique or intervention that can recover the stress level among students are needed to develop and applying among problematic students. Progressive muscle relaxation, or known as PMR, it's according to the previous study showed that PMR are closely related to stress experienced by the client, either physical or psychological stress. And the changes of condition happen because there is a change of nerve impulse in the afferent pathway to the brain, where inhibition of activation becomes. And few other studies show that, like the study of Hassan Purdekodi and Jalali and a few other scholars, show that PMR can reduce physical and psychological stress experienced by the client. As we know that PMR basically, they have a few steps of PMR. One, we have to ask the client to sit on the chair and scrunch your face, count until 1, 2, 3, take a deep breath and relax, and then tense their arms. You know, this is few other technique. And then tense the arms and the shoulder, tense the legs, and breathe in relaxation or breathe out the tension. This is few steps that PMR usually have been done among clients. So this is what actually we want to emphasize or impose in our client in order to see their changes. Apart from PMR, we also use the spirituality aspect. Okay, if we can see from here, the psychospiritual therapy process is divided into 3 stages, namely self-awareness, self-esteem, and self-development. Self-awareness is actually referring to the self-conscious. Self-esteem is the self-worth, how you see yourself, how you love yourself. And self-development is how the human can develop through the lifespan. So using the methods of zikir, istighfar, and salawat is few technique of spirituality emphasized during this research. And if we can see from this research, we are using the biofeedback training. The biofeedback actually is the mechanism to measure the heart rate variability, or known as HRV. There are few other division or reading based on the red color. We call it as the VLF, very low frequency. And then the blue color, the low frequency, or LF, whereby the green color referring to high frequency, or HF. Okay, the method of this study is quantitative using the quasi-experimental, which we divided the sample into two groups, which is namely control group and the treatment group. So the location is in the Technical Institute, and we have about 4 weeks to complete this research. So this is basically the procedure. First, we identify the problematic student using the record of from the counselor, and also we give them the DICE inventory. Yeah. DICE is depression, anxiety, and stress scale, which is they can measure the depression or kemurungan, the anxiety, kebimbangan, as well as the stress, tekanan. Okay, then we give them the pre-test as a baseline of the biofeedback. We try to measure to gauge their biofeedback score or section, and then we divide them into two groups, the treatment group and the control group, namely BFB, PMR means the progressive muscle relaxation, plus the BFB is biofeedback. Okay, and then for about 4-week session, we end and we do the post-test after the pre-test earlier, and then we give the intervention, and then we give them the post-test using the DICE and also the biofeedback. So this is the score. If you can see here from the HRV spectrum, heart rate variability, the Newton hati. From that, we can see the very low frequency. We just can referring from the treatment group here. If we see here, the very low frequency VLF rate, the PRA is 60.5. Maksudnya they have very high in VLF, but after the treatment, for the PASCA value is only 4.4, so it reduced. So other than that, from the biofeedback red blue color here, the LF, low frequency, if you see the treatment group, basically they have a moderate 20.9 value, and then it's lower to the 11.4 after the intervention. And the third one is a high frequency, which is the good one. The high frequency means the client or the respondent can control themselves. They have a good control, inner control, they feel calm, okay? So for this score, we see that the PRA score is quite low among students, which is 17.4, but increased after the intervention was made to the 84.2. Okay, so basically we can say that the intervention is successful in increasing the score of the biofeedback, and also reducing the stress, anxiety, and depression as well. Okay, basically PMR is one of the methods that is less used in social setting compared in the medical setting. Application and usage of the PMR should be practiced, especially during deal of psychological stress among students. PMR integration with spiritual drive, mind, and heart to interact simultaneously in full awareness of one's body action. Spiritual element also give a sense of relief and reliance on God's strength and to act independently by the client in the future. As a conclusion, developing and practicing more creative and comprehensive intervention technique toward our youths, mostly among technical university students, really needed in order to solve the problem of targeted or particular group. Developing the up-to-date technique are really important to kettle down and solve the serious problem among community as well as among our students. Thank you very much.